The Let's Cover That podcast is brought to you by CM&F Group, professional liability services for over 200 healthcare professions. Visit our website at cmfgroup.com/podcast for more info.
Hey everybody, another episode of Let's Cover That with Will Sullivan and my co-host,
Antonina Agruza. And today we have with us the Chief Growth Officer at aiHealth, Kyle Swarts. Kyle, thanks so much for joining us today.
Thanks for having me. Look forward to the conversation.
Same here. So Kyle, tell us a little bit about your background in healthcare and what brought you to aiHealth.
Yeah, thanks. So I've had the good fortune over the last 15 plus years to work alongside some pretty amazing humans in the healthcare technology, medical coding, and consulting spaces on both the provider and payer side of the house, which has really given me kind of good visibility into some of the efficiencies or inefficiencies in healthcare. And I think we still have a long way to go. My career has kind of taken me down a technology path, a consulting path. I was a partner in a consulting firm for a number of years. And prior to joining aiHealth, I was with Curation Health, which is in the risk adjustment and quality space. And I think the other thing that's kind of important is not just having a seat inside the four walls of a healthcare organization or a health tech business. It's also diversifying your experience and being on board. So I've had the fortune of being on the Maryland HIMSS board of directors for a number of years, working alongside technologists, operators, entrepreneurs, looking at healthcare from a multitude of lenses. And it's been really refreshing and humbling to be able to sit next to a CIO that's been leading a massive implementation, or an entrepreneur that just successfully exited a company after being able to solve some of the major issues in remote patient monitoring or medical coding. And then just actually was asked to join aiHealth Solutions, which is a subsidiary of Providence St. Joe's Health System, where they're providing services to health plans. And so we need to look at everything we're doing today, not just primarily through the patient lens, but from the provider lens, as well as health plans and that collaboration or the lack of collaboration that's happening, so we can close some of those gaps fundamentally. I started at AIH about 45 days ago, so I'm relatively new and fresh. But the good news is that I've had the opportunity in a previous life to work with our investors and board. And over the last 18 months, we've spent a lot of time creating our digitally enabled coding product to support automating medical coding so that we can bring the joy back to provider care, bring the joy back to medical coding, and bring a better quality and documentation to our patients. And so we're set out on a journey to really leverage AI and machine learning to support organizations in that mission. And my responsibilities here are to oversee growth, marketing, and our strategic partnerships. And we've got a really great technology team that's both domestic and offshore. And we're building some pretty cool, innovative capabilities to support automating the medical coding space.
Yeah, so can you give us, Kyle, just like an overview of, aiHealth and, what's that, user journey that you guys are kind of bringing to the fold, from you're going from provider, making their life a heck of a lot easier, all the way up to medical coders and kind of getting the billing kind of taken care of through machine learning and AI.
Yeah.
So what's the general rundown about that for everybody?
Well, I think what we've seen as a leadership team and investors and founders at aiHealth is just there's still continued inefficiency across the board. And how do we take and eliminate or reduce the menial tasks that humans have to do on a regular basis and allow AI and machine learning and other contemporary technologies to serve as a partner to humans who, candidly, there's a labor shortage. There's not droves of medical coders signing up. They're maturing out, seeking retirement. So we have to figure out how to automate this. And that is really what we're set out to do. And so what we're doing is we're taking those years of experience and saying, let's just focus on one task, medical coding, not trying to boil the ocean, not doing prior auth, not doing customer service, not trying to say, well, what, Mr. Customer, would you like for us to solve today? We know what needs to be fixed, and that's automating medical coding. And so The current state is not ideal. Computer assisted coding still requires 100% human review. Data management and stewardship is really much to be desired. And a lot of these things, while menial tasks, they're error prone. And so, how can we pair a human with the latest and greatest technology to deal with the labor shortages and the inefficiencies? So that's our DNA. And again, years of experience being able to bring that forward has said, let's not just focus on everything. Let's focus on how we can be the best at automating medical coding for a specialty or multiple specialties, whether inpatient or outpatient. And this is actually refreshing for many of the CFOs, the VPs of revenue cycle and medical coding to hear that we're singularly focused on solving a very specific but important problem as they look at what does it look like the next 2 to 3 to 5 years with their staffing size and structure, as well as growth plans, either organically or via acquisition. So we're heads down on trying to figure out and designing technology to do that, and keeping kind of the quadruple aim of healthcare in mind along the way, and really trying to bring the joy back to medicine.
Yeah, I love the, especially the joy aspect of what you're talking about. And, because anybody that, our company included, you create this nice digital framework for the client side, but nobody's really thinking about the internal side of, you know, there's a different painful process operationally with a CRM that people normally don't see on the client side. But I did want to just add one more question. What's the delta you see outside of the improvements and removing error proneness? What's the delta that you see these organizations, these providers get outside of the joy? Removing errors, clearly like helping facilitate scalability without the headcount shortage issues on medical coding. But what other substantive delta do you see from before and after utilizing AI health?
Yeah, and again, the lack of automation wastes talent and time, and in a competitive market, retention is key. And so, as I said, there's probably 20 to 30% vacancies within revenue cycle management departments today. So how do you do all of that work, right? How do you get paid? And as we know, with COVID, health systems and physician enterprises are still a bit underwater because of the lack of care that was received, and even with some of the government funding. So what we're seeing is a collaboration between a human and tech to reduce some of the menial tasks that a human has to do every day, allowing them to focus on the more complex cases. So reallocating that work and reimagining their process. The second would be FTE allocation. If you're short staffed 4 coders, you're not going to find 4 coders. Or if you do find 4 coders, you're going to have to go out to the consulting market, and you're already kind of getting crushed from a cost to collect perspective. And then the others are, can we decrease denials? And we are decreasing denials across the board because we're making sure that the right documentation, the right codes are supported so that when it gets to the payer, it's not denied. And we all know how much denials cost to rework, both from a time and cost perspective. And as I said before, we're not seeing an influx of net new medical coders. And so this is a prime opportunity for us, again, to reimagine the process and bring the right individuals to bear. And we should look at efficiencies in operations. We should see better accuracy of medical coding, and we should see some cost containment exercises across the board. And I would even argue that with the right documentation and coding, there's a direct correlation to clinical quality and outcomes. Incorrect and inaccurate coding results in the incorrect and inaccurate treatment plan for a patient that has multiple chronic conditions, for example, or a patient that has an orthopedic procedure with complications. We need to make sure that we're documenting and coding appropriately. So we look at this as an efficiency opportunity, an accuracy opportunity, cost effectiveness opportunity, but also a quality opportunity too. And I think that's really important.
So Kyle, you mentioned that you're relatively new to the AI Health team. Can you tell us a little bit about what you see the evolution of the company being and what's next for the platform?
Yeah, thanks. So we, the platform is live and operational. We've got a current client up and running. We're in the process right now of identifying 3 or 4 additional early partners. And for those that are listening, they've likely been on an entrepreneurial path. You do need to find some of those early adopters for your alpha beta sites who are going to be good strategic partners, understand the evolution. And so that's where we're at in our journey. And I'll tell you guys, I've been absolutely humbled by the market interest to be an early adopter with aiHealth. And I think that speaks volumes to the credibility of our board, the credibility of our team, and the fact that we're not trying to boil the ocean. We're thinking big, but we're starting small and being laser focused in a single area. I think over time, we'll start to develop more auditing capabilities. I think we'll get into multiple specialties. And I also think that there's an opportunity maybe to get into HCC coding, which is huge in the value-based care space, but highly complex and a lot of compliance wrapped around it. So over the next number of months here, we're going to be deploying and optimizing and engaging new partners, and at the same time building out the team. I mean, you're only as good as the folks that are in the game with you or on the bench in support roles. And so we're excited about bringing on some additional professionals on the implementation, the coding, and the engineering side of the house. So in the next 6 months or so, there'll be a little bit different story and probably a little bit more data behind how many FTEs we were able to reduce or reallocate, how many codes were autonomously coded, and some of the other key revenue cycle metrics. But yeah, certainly looking forward to the next 6 months, and we've got a lot of work to do, like any early stage organization.
Yeah, Kyle, is there a specific niche that your team is looking at specifically on the growth? Is it primary care? Is it, ambulatory surgery center? Is it, what does that look like start? And as you mentioned, kind of expanding out into different specialties.
Yeah, great question. So our initial focus is largely going to be on the outpatient side of the business, where there's a lot of transactions that require human touches, a lot of physician-directed coding, and so how can we help automate those processes? We'll move into ambulatory surgery centers. If you think about a lot of the high cost outpatient procedures, knees, hips, gastro, ophthalmology, those that are areas in which we think that there's significant value and ROI. And then horizontally, we'll start to think about where do we go next, right? But I think what we found from the market and the feedback is that we are kind of laser focused in a certain area. And unlike other startups, we're okay to say now's not the time. We're not quite ready. And I think that's also refreshing for organizations that we've seen in the news that are trying to take on way too much. And as a result, they're not delivering on those relationships that we at aiHealth hold so dear to our heart. And so how do we focus on creating tons of value with 3 or 4 customers in the immediate term, and then learn from that? Because AI and ML does not learn overnight. It's a continuous learning exercise. And so if we think that we've got everything figured out, we're going to automate 100% of the medical codes, everyone's foolish. That's not going to happen. And we're still going to need humans, medical coders, experienced staff to partner with us. Our job is really just to make them more efficient and make them really enjoy what they're doing, not having to be doing the remedial, menial tasks of the day. And so we're really excited about how the product and team's going to evolve to that.
Yeah, and I'm sure it's super refreshing for providers to hear that we're not trying to eliminate jobs. You're trying to automate someone's job and just make their day easier and more efficient. So that's really awesome what you're doing. Is there anything else that you would love for our listeners to know about aiHealth?
I just think in general, to quote John Halunka, who is leading some of the Mayo Clinic innovation efforts and just around AI and ML, it's a relatively immature space. And a lot of people are trying to understand it and digest it. And so when you're looking at strategic partners, make sure they get it. There's some education that they'll need to provide. There's some trust that will need to be instilled. And as Mr. Halunka said, it's math, not magic. And so it does need to be fine-tuned over time. And so it's a continuous learning exercise. But we at aiHealth have a great team and excited about what the next 6 to 12 months will bring. And if you guys are interested, check out our website. But we appreciate the opportunity to speak with you guys and your customers today.
Yeah, amazing. Thank you so much, Kyle, for hopping on.
You bet.
Thank you.
Thank you.